Thank you for being here. Thank you, Global Watch Cluster, for inviting me. So I'm Camille Aylan from Tufts University, and today, as Alecha mentioned, I will present the findings of the study we recently completed in collaboration with the Global Watch Cluster on the WASH coordination. But first, I would like to give you some background just to understand how this study is integrated into overall research led by the Global WASH Cluster on WASH coordination. So it started 4 years ago when Tufts University completed a summary of the evidence on WASH coordination from existing literature and from interviews conducted with WASH coordination experts. Among the conclusions, one of them was the need to include more feedback from more relevant stakeholders to assess the WASH coordination. And therefore, a few years later, we assessed the outcomes and the impacts of the WASH coordination by gathering feedback from WASH coordination platform staff and partners from 3 different contexts. Overall, those 2 studies led to a deeper understanding of the value of the WASH coordination and culminated with the development of a theory of change to base a logical framework for the WASH cluster approach. Additionally, key themes were consistently identified throughout those 2 studies, including the fact that WASH coordination platform staffing is crucial and successful staff have and utilize both technical and social skills. However, despite UNICEF guidance on the minimum structure of coordination teams at the national level, and despite the needs for coordination on the ground, not all coordination platforms are fully staffed, which has likely consequences on the outcomes and the impacts of the coordination. And therefore, the goal of the study I will present you today is to assess the value add of the WASH coordination for different coordination staffing levels. So to do so, we selected 5 different contexts with different staffing levels, with Yemen in yellow on the map as considered as a high staff team at the time of the study. We also included the Democratic Republic of the Congo and northeastern Nigeria, considered medium staffed team. And lastly, we also included Central African Republic and Colombia into the study. Context-specific evaluations were completed by collecting information from staff via the completion of a monthly activity report, but also via key informant interviews. And we also collected information from partners, also via key informant interviews, so 1-hour discussion, and via an online survey open to anyone who self-defined as being involved in the WASH response in the specific context. And we asked them questions about the activities completed by the WASH clusters, the outcomes, the challenges, and also the recommendations they may have to improve this WASH coordination. Data were collected at two times during a 6-month period, and we used existing framework to analyze the results, including the theory of change that I just mentioned earlier, but also the minimum requirements, which is an existing framework developed by the Global WASH Cluster to monitor the humanitarian core function for national WASH coordination platform. So data collection ended in June 2023, so a few months ago, and during the 6 months of data collection, we were able to collect 31 monthly activity reports, 475 surveys from partners, and we conducted more than 100 interviews with staff, but also partners from local NGOs, international NGOs, from the donor side, and also government officials. So today I will present you the main findings of this study, but I just want to make sure that you're aware that with the mixed method approach that we use, we were able to collect a lot of qualitative and quantitative data that I won't be able to present you today, but this data was summarized into individual country report that we shared with the WASH coordination platform staff, and those reports will also, of course, be available to anyone who is interested. But here, so the main result, the first one was that no context had the perception to have an adequate level of staffing and coordination. So partners and staff in country discussed several challenges regarding the staffing, including that some positions were unfilled at the national and subnational levels, but also double-hatted, so some positions were not dedicated to the coordination. They also mentioned a high turnover among the coordination team, which led to lower staffing levels. Additionally, they discuss other challenges, not really related to staffing, but more to the coordination level, including challenges related to the context, but also to the overall coordination structure, which suggests the fact that, of course, there are several factors to assess to define what's an appropriate coordination and staffing level. Despite those challenges, the WASH coordination platforms have a minimum set of activities to complete, what we call here the minimum requirements for an effective WASH coordination. And I represented here those minimum requirements, even though I won't go through them, but it's more for you to have an idea of what those minimum requirements are. And what we observed in this study is that similar minimum requirements across the 5 contexts were more met than others. So whatever the level of staffing and level of coordination, same minimum requirements were met, including those one in dark green. And thanks to the completion of activities related to those minimum requirements, most partners agree to say that the WASH coordination helped them to make strategic decisions, to identify the gaps in the response, but also to obtain funding and to build their own capacities. On the other hand, other minimum requirements were less met, and this was consistent across contexts. And this suggested a gap, a consistent gap between the expectation that we have for the WASH coordination platforms and also the levels of staffing and support that we are currently able to provide. Of course, there were also differences between contexts. So, for example, in Yemen, we observed that they were more able to work on WASH strategies, to update them. They were also able to work more on the accountability to affected population on specific tools. And in Yemen, actually, as I mentioned earlier, Yemen was a highly staffed team, so stable team with 5 dedicated positions, and therefore we attributed those differences, of course, to the difference in the coordination levels. We observed also other differences across contexts, and again, those differences were attributed to the levels of staffing, but also to the context and also to the overall coordination structure. Another observation that we made was that most partners mainly positively discussed some minimum requirements, which are here, but they also provided most of the recommendations on those specific minimum requirements. On the other hand, only a few partners discussed other minimum requirements and provided recommendations to improve the one they poorly mentioned. And so those results may suggest 2 different things. One, there is some minimum requirements are more important for partners than others, or maybe that partners are not aware of the full set of activities, the full mission of the WASH coordination platform. And this may suggest a gap of knowledge or awareness of partners for the WASH coordination. We also observed contradictory information. So partners, there were contradictory information between some partners and between staff, which also suggested that there was a gap between the work that is accomplished and the perception of what is currently done in the field. Lastly, we discuss impact of the WASH coordination on the beneficiaries. We discussed with partners and staff, and so on the 2 different beneficiaries, so the impact on partners and the impact on affected populations. And staff and partners mentioned that the main impact of the WASH coordination was that it provided a more effective and strategic response by sharing more information, but also by improving the visibility of the WASH sector and by building and improving partners' capacity. According to partners and staff, the main impact of the WASH coordination on the affected population was that it helped to better target the population with the highest needs, and also to avoid the duplication of the activities. But of course, some partners and some staff mentioned the fact that it was difficult actually to have an idea and to measure, to know the impact of the WASH coordination on affected populations, because most of them were not aware of the WASH coordination mechanisms. So to conclude, in this study, we observed similarities and differences in terms of minimum requirements, so actions, activities done, and outcomes. And those differences and similarities were attributed to different levels of coordination, but also to a consistent gap between expectation and levels of coordination. We also highlighted key factors on which we could work to improve the WASH coordination. The first one was to find the balance, the right balance between the levels of coordination and the expectations that we have for those specific WASH coordination platforms. To provide support to work on response quality monitoring and accountability to affected population, because those were the minimum requirements, the less mentioned as met by the partners and staff. And also we may want to work on the communication and coordination with partners to try to reduce this gap between the action done and the perception of what is done. So it's been a few years that Tufts University with the Global WASH Cluster is working to try to assess the WASH coordination in humanitarian context. So it started first by including feedbacks from WASH coordination experts, but step by step, we were able to include more and more feedbacks from more and more relevant stakeholders and from the beneficiaries of the WASH coordination. Of course, there is still this last step. How can we involve the affected population to assess the WASH coordination if they are less aware of the coordination mechanisms? But it's on what future research should focus to assess the impacts and the outcomes of the WASH coordination. So I really thank you for your attention. Thank you for Global WASH Cluster for inviting me today, and a main thank you to all people, so the WASH coordination platform staff and partners who volunteered the time to provide their insights, feedbacks, recommendations to try together to improve this WASH coordination. So thank you.
Thank you so much, Camille. Perhaps we'll need another microphone, please. It would be time for a Q&A now. So are there any questions online? So far, I'm looking at my colleague, Julie. None. Perhaps in the room. Any takers? Yes, sir, please go ahead.
No. Okay. Thomas Fernandez, University of the Thai Chamber of Commerce. I have a question to your methodology. I saw you mentioned mixed methods, and then you mentioned over 100 interviews. So interviews are qualitative, opinions, perception. So did you also make any quantitative research on this one?
So we mainly did quantitative research. Thank you for your question. So we mainly did quantitative research with the online surveys. So we collected more than 400 surveys. And so this helped us so during these surveys, we asked very specific questions, and this helped us to have quantitative data that helped us to also to understand the qualitative data that we collected. And also with the monthly activity reports, this was also quantitative. So it helped us to also to have a kind of a baseline of information, quantitative information, to discuss further with during the interviews with the WASH coordination platform staff.
I have another question. This is a very, very good research. So it should provoke questions. You have two groups of respondents. One is staff and one is partners. Did you compare them against each other, like ANOVA or something like that?
Yes, we did. So this was the details information that I was not able to discuss with you today, but we did in the country report. We divided all the information we collected by staff, by partners, and also partners from the interviews, but also from the online surveys to make sure that this information matched together. Thank you.
I'm going to try and phrase them as questions. They might also be just reflections, but it was really interesting for me to see the needs assessments and the accountability to affected populations being weak. And it reminds me of the question that came to our panel in terms of how can we do that better collectively. And I think those are two areas that consistently have seen so many different competing frameworks that it's an incredible challenge for a cluster to actually harmonize within a given country. But it's an area that if we pull it off, it has a huge impact. So I suppose that's more of a reflection. And actually one other reflection, just to add weight on the communications on action and perception. One other aspect that I've seen more recently beyond the expectations on the 6+1 core functions and actions against that, expectations that we perform functions beyond the 6+1 core functions, and a mission creep that is actually often facilitated by other colleagues in our humanitarian structure. Ukraine is a particular example where often we have references from our colleagues in OCHA for things that are not humanitarian, but there's no one else to pass it to. And I think that's perhaps one other element there that's a growing challenge for us.